Today I'm going to discuss synergy. Synergy can be discussed in many contexts, but today I'm going to discuss synergy as it relates to herbal medicine. Specifically, I will delve into synergy in a general sense, synergy within one herb or plant, synergy as it applies to herbal formulas, and how the mainstream pharmaceutical industry views and utilizes synergy. The term synergy comes from the Greek word synergos, which means working together, and as well perceived and quoted by Buckminster Fuller in 1968, the universe is synergistic, life is synergistic. Synergy is broadly defined as the interaction or cooperation of two or more substances, organizations, or other elements to produce a combined effect greater than the sum of its separate parts. Synergy has been adapted by societies to create greater efficiency over millennia in a variety of ways. Native Americans farmed using synergy. They planted crops of winter squash, corn, and beans to provide mutually beneficial effects for the land, the plants, and ultimately the humans who ate them. The plants help one another, with the tall-growing corn providing the structure the beans need to climb, and the beans in turn enrich the soil with nitrogen that all the plants need. The squash spreads out along the ground, which blocks the sunlight to prevent weeds from thriving. The leaves serve as a living mulch to lock in moisture, while the prickly hairs on the squash vines deter insects and other pests. We also see the general concept of synergy within the human and equine bodies. Muscle groups working together result in a greater force than a force that can be generated by a single muscle. We also see synergy in the body when looking at the function of digestion and immunity. Within the small intestines, we find billions of bacteria that provide support to the immune system by neutralizing potentially harmful substances that are ingested with food. Similarly, bacteria also assist in breaking down foods into smaller and smaller molecules that allow the body to obtain nutrition to fuel the functions of the immune and other systems of the body. Speaking of digestion, we can find synergy in the foods we, as humans, eat. Many phytonutrients in fruits and vegetables, such as the carotenoids that give yellow and red produce their vibrant color, are better absorbed when consumed with some dietary fats. Adding vitamin C helps the absorption of plant-based iron foods like spinach or chickpeas. Now that we have a basic understanding of general synergy, let's take a look at synergy in individual herbs. Synergy in the context of herbal medicine is understood as the effect of individual components in an individual plant or of the combined components of many plants in an herbal formula interacting with one another to produce desired effects that could not be achieved by one component acting alone. This concept is why herbalists favor using whole plants, rather than attempting to isolate an active ingredient. Herbalists know that whole plant extracts are made up of more than one active ingredient and have more than one action or usage. The holistic principles that underlie herbal medicine and the complexity of plants are key considerations when making an herbal preparation. Complexity and the potential synergy of each herb require thought and knowledge to reap the full benefit of all the herbs in a preparation. Herbalists prioritize the natural complexity and synergistic effects of the whole herb to create a safer, more effective, and holistic approach to healing. Synergy in a single herb refers to the idea that the combined effect of different compounds within the herb is greater than the sum of their individual effects. This means that different chemical constituents within a single herb can work together in a way that enhances their overall medicinal properties. Medicinal plants contain hundreds, if not thousands, of unique compounds. Models based on single molecular entities do not accurately describe or capture the complexity of interactions among the constituents in medicinal plants and multi-constituent extracts made from them. Herbs contain many compounds that work together. Isolating a single compound does not capture the full therapeutic potential because the other components are essential for proper absorption, metabolism, or action within the body. Herbalists generally don't isolate active ingredients because they believe the whole herb, with its complex mix of compounds, provides a more effective and holistic treatment. Isolating one compound can disrupt the synergistic effects of the other compounds, potentially leading to less effective or even adverse reactions. Today, the process of extracting leading active ingredients is commonplace and is called standardization. It's all the rage throughout the chemical and natural food industry. The theory is that if one dose of a suspected key ingredient is good, a large dose all at once of that ingredient is better. Not so. Herbalists will tell you that those leading active ingredients are properly placed, by nature, in proportions mixed with other ingredients to keep the herb in perfect balance synergistically. When taken in whole form, those constituents present to the body in a balanced solution. A single herbal medicine or medicinal plant may contain hundreds, if not thousands, of natural constituents, and a mixed herbal medicinal product may contain several times that number. Suppose every active ingredient were to be isolated from individual herbs from which the herbal medicine is formulated or produced. The time and resources would be tremendous. Such an analysis may practically be impossible, especially where an herbal product is a mixture of two or more herbs. Let's take a look at turmeric. Turmeric is one of the most scientifically studied herbs. Curcumin has been identified by scientists as the primary active ingredient and has been the focus of extensive research for potent anti-inflammatory, antioxidant, and potential anti-cancer properties. Scientists have isolated at least 235 chemical compounds in turmeric. Many of the identified compounds have been shown to have various biological activities. However, scientists have completely ignored the synergy that exists between these identified compounds. How can we be certain that there are only 235 chemical compounds in turmeric? How can we know for certain that curcumin is the active ingredient and that it alone provides the desired actions? Perhaps we should study the synergy of curcumin with the so-called inactive ingredients to truly understand how turmeric actually works. Or perhaps we should just rely on centuries of use and utilize turmeric as nature intended, without trying to only use its individual parts. Research has shown that synergistic interactions within single herbs can lead to enhanced therapeutic effects. For instance, a particular compound in an herb might work with other compounds to improve its anti-inflammatory or antioxidant properties. To better understand synergy within a single plant, let's look at Oregon grape. Scientists have determined that berberine is the active ingredient that is extracted from the roots of the plant and many other species in the genus Barberry. However, multiple alkaloids are found in these species, and multiple studies have found simple extracts of the roots from various species to be more effective than isolated alkaloids or active ingredients. Furthermore, non-alkaloid compounds, including those found in the leaves, have been shown to reduce bacterial resistance to the alkaloids, suggesting a potential type of synergy between different parts of the same medicinal plant. As an example, a crude ethanol extract of Bulbaris vulgaria or Barberry was more effective than isolated alkaloids or alkaloid fractions in rodent models of acute and chronic inflammation. Simply stated, scientists are overlooking inactive ingredients in a plant and therefore missing out on key information and uses of plants. Another example where the whole plant was more beneficial than an extracted active ingredient involved Coptis chinensis, also known as Goldthread, Rhizome. Scientists tested extracts of the active ingredient as well as extracts of the whole plant. What they found was that the whole plant extract had more active hypoglycemics than the extract of the active ingredient. A combination of 4 active ingredients, namely berberine, copticine, palmitine, and epiberberine, were more hypoglycemic and less toxic to liver cells than berberine by itself. Interestingly, an extract of the whole plant that was then enriched with active ingredients killed 100% of male and female Kunming mice at a dose of 0.28 grams per kilogram. No mice were killed when the whole plant extract given at the same dosage was administered to the mice. Clearly, the whole plant extract was non-toxic, while the enriched extract was fatal. Not surprisingly, we should leave nature alone and use the whole plant. One final example of intra-plant synergy can be seen in the herb Artemisia annua, also known as sweet Annie. Scientists have isolated and determined that the so-called active ingredient in sweet Annie is artemisinin. Artemisinin and various semi-synthetic derivatives of it are among the most widely used antiplasmodial drugs in the world. It seems to be largely assumed in mainstream medicine that this is the beginning and ending of sweet Annie. Artemisinin is the silver bullet, and there is nothing else worth investigating about the herb. However, a clinical trial using a crude decoction of sweet Annie dramatically lowered parasite burden in adults in the Democratic Republic of the Congo with chronic malaria, with cure rates on average of 74%, despite providing far lower levels of artemisinin than are used as an isolated drug, suggesting that there is more to sweet Annie than just artemisinin. Herbal formulas contain multiple chemical compounds. Particularly in reference to the synergy of herbal compounds, this phenomenon is known as the entourage effect. This effect takes place even with single herb extracts and exemplifies the polyvalent effect of botanical medicine. However, botanical medicine has traditionally relied on multi-plant formulations, and over time, traditional practitioners have noticed that long-term use of combined herbal preparations tend to show better efficacy than that of isolated single plants. A unique type of synergy between active molecules is what occurs when one of them acts simply to inhibit or minimize the adverse effect of the other. Some authors do not consider this type of combination as a synergistic effect, as only one of its components can produce a response, while the other merely reduces the adverse effect of the first without affecting its activity on the target. Let's look at an example of this type of synergy. The European Central Asian Glycyrrhiza glabra, or licorice, is one of the most important and widely used herbs in the world. One of its major uses, particularly in Chinese medicine, is to act as a corrective agent, meaning to decrease the toxicity of other herbs with which it is combined. A classic example of this corrective assistant effect is pairing licorice with aconite. Aconite, also called wolf's bane, is highly toxic when taken by itself. One in vitro study using rat heart cells found that licorice prevented the tendency of aconite to increase pulse frequency of cells, and also inhibited the increase in lactate dehydrogenase by aconite. In other words, licorice decreased the toxicity of aconite on the heart cells when used together. Plants contain compounds that do not have specific pharmacological effects, but increase the solubility, absorption, distribution, or metabolism of their active constituents, which will result in greater bioavailability, allowing greater efficacy of the extract compared to the individual constituents. The presence of compounds that improve the solubility and bioavailability of bioactive constituents is a particularly important type of synergism that is underestimated by science. By addressing multiple targets via botanicals, the combination of different plant chemicals acting on multiple body pathways can cause an increased therapeutic benefit and increased bioavailability when compared to a single component working on a single target. An example of this type of synergy in the plant world involves an in vitro study of two common Chinese herbs, Astragalus membranceus and Glycyrrhiza urulensis, Chinese licorice. When combined, these two herbs provide better cell protection, creating elevated antioxidant levels and greater antioxidant enzyme activity when compared with just the single herbs by themselves. Now that we have discussed herbal synergy, I think it is worthwhile to take some time to also look at pharmacological synergy. Pharmacological synergism seeks to isolate the active ingredient from a medicinal plant and then utilize the ingredient to target a specific bacterium, cell, or achieve a specific desired effect. This philosophy leads scientists to disregard the whole plant and only seek out specific compounds found within a plant. In the early 19th century, the ability to chemically analyze plant compounds spurred scientists to isolate and study active ingredients. Extraction of active ingredients marked a shift in medicine, moving from whole plant remedies to purified, concentrated drugs, which became more dominant. In 1803, morphine became one of the first drugs to be isolated from a plant. It was identified by Frederick Serturner in Germany. He was able to extract white crystal from crude opium poppy. In 1852, scientists were able to synthesize salicin, an active ingredient in willow bark, for the first time. By 1899, the drug company Bayer modified salicin into a milder form of acetylsalicylic acid and launched aspirin into our modern world. The synthetic age was born, and in the following 100 years, plant extracts have filled pharmacy shelves. Isolation and characterization of pharmacologically active compounds from medicinal plants continues today. Although many medicines have been produced from plant extracts, chemists sometimes find that the synthetic versions do not carry the same therapeutic effects or may have negative side effects not found when using the whole plant source. My opinion is that these negative effects are due to the lack of synergy in the synthetic drug. The American Society of Pharmacognosy refers to pharmacognosy as the study of the physical, chemical, biochemical, and biological properties of drugs, drug substances, or potential drugs or drug substances of natural origin, as well as the search for new drugs from natural sources. As practiced today, pharmacognosy involves the broad study of natural products from various sources, including plants, bacteria, fungi, and marine organisms. Pharmacognosy includes both the study of botanical dietary supplements, including herbal remedies, as well as the search for single compound drugs that may proceed through further development into FDA-approved medicines. Drug discovery from medicinal plants has evolved to include numerous fields of inquiry and various methods of analysis. The process typically begins with a botanist, ethnobiologist, ethnopharmacologist, or plant ecologist who collects and identifies the plant or plants of interest. Collection may involve species with known biological activity for which the active compounds have not been isolated, like traditionally used herbal remedies, or may involve plants collected randomly for a large screening program. Phytochemists, also known as natural product chemists, prepare extracts from the plant materials, subject these extracts to biological screening in pharmacologically relevant assays, and commence the process of isolation and characterization of the active compounds through bioassay-guided fractionation. Molecular biology has become essential to medicinal plant drug discovery through the determination and implementation of appropriate screening assays directed towards physiologically relevant molecular targets. In many cases, scientists are not sure what specific ingredient in a particular herb works to treat a condition or illness. In the mainstream pharmaceutical view, there is a single active constituent in a plant that explains its activity and which can be isolated and used as a conventional drug. This idea is reinforced by the fact that many widely used drugs are either single molecules isolated from plants or semi-synthetic versions of natural molecules. "40% of the drugs behind the pharmacist's counter in the Western world are derived from plants that people have used for centuries, including the top 20 best-selling prescription drugs in the United States today." However, this still does not prove that the single compounds are superior to complex mixtures, particularly when possible beneficial effects of various compounds that indirectly support the main desired action have not been assessed. The single-molecule drug formula is further called into question when you consider that 60% of all pharmaceuticals are recalled within the first 10 years of their offering to the public. The 20th century model of using a single drug acting on a single biochemical pathway is showing its age, especially when it comes to chronic disease. The model's limitations, including massive problems of drug toxicity, as well as poor efficacy in the face of complex chronic illness, have become evident. Over time, a slow trend in medicine can be seen moving away from this dogma of single drug applications towards more modern multi-drug cocktails. Even scientists are beginning to understand that synergy is necessary to successful treatment. This shift is mainly because of the ineffectiveness, resistance problems, and side effects that appear when using synthetic monoactive ingredient drugs, especially in the treatment of chronic diseases such as cancer, atherosclerosis, diabetes, and inflammation. This new approach lends credence and legitimacy to botanical formulation because it provides a pharmacologic rationale and shows the wisdom of therapies containing multiple chemical compounds. Compared to single-molecule drugs, plants can provide the therapeutic possibility of equal or greater efficacy with reduced toxicity. I know I prefer to use synergistic herbal formulations on myself and my horses because herbs are effective, synergistic, and designed to work with our bodies the way nature intended. As always, thank you for joining this week's podcast. If you like this podcast, please like, share, follow, or subscribe. You can find this podcast on Spotify, Apple, iHeartRadio, Rumble, and YouTube. If you have questions about herbs, herbal synergy, or how herbal formulations can help your horse live his or her best life, give Kayla a call at 970-596-7443. Please join me next week on the podcast to discuss the different types of herbal formulas.